Call this joint meeting of the school committee and the Fitchburg Board of Health to order, September 23rd, 2021, at 5 p.m. Mr. Thompson, would you lead us in a Pledge of Allegiance, please?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Proceeding to the agenda item first on the list, COVID-19 update. That would be Mr. Curry. If you would provide that for us, we'd appreciate it.
If it be okay, I will remove the mask. I will continue to social distance, but I want to be able to make sure that folks can understand me, if that's acceptable to all. Okay. A short presentation, just some statistics, if you wouldn't mind flipping the first slide. So here we have an update of what COVID-19 looks like in Fitchburg. As of noon today, we have 242 active cases. That is actually 6 more than we had on Monday. In the last 7 days, we've had 137 confirmed cases. That's 9 less than Monday. In the last 2 weeks, we've had 264 cases. That is 30 more than Monday. The last 30 days, 437 confirmed cases. And so total cases since March 1st, 2020, when we began tracking this, is now at 5,393 total cases. As of noon today, our positivity rate is over 5 again. It is at 5.7. So that's 252 positives in the last 2 weeks. 4,982 tests. That's DPH statistics. Those will be on the webpage sometime this evening. On the right is and I thank Superintendent Jokeler. He has prepared a graph here, kind of shows the cases from August 13th up until September 20th. So it's a steady rise in the last month. Next slide, please. So I did a little comparison from where we were in a similar time frame from 2020 to 2021. As you can see, at this time last year, we had 862 total cases, total confirmed cases. This year, we are at 1,229, which is 367 more cases. Active cases, at this time on September 23rd last year, we had 12. Today, we have 242. Deaths, at this time last year, between March and September, we had 81 deaths. Many of those were in our nursing and long-term care facilities. As of today, as of 2021, we've had 8, which is absolutely terrific, 73 less. Deaths in August to September, in 2020 we had 1, and in 2021 we've had 2. Next slide, please. This is a quick glimpse, and I know it's very tough to see, but apologies, but this is a quick glimpse of all the hospitals in the region. Very quickly, if you scan to the middle, you will see in the surge space in use. All but one of the facilities have surge space being used by COVID patients at this time, which is a great sign. However, you see in UMass, they have 14 spaces taken up in the surge unit. A couple of spaces down, you'll see COVID in-house column. And that is a snapshot of the cases that the hospitals are experiencing. I believe this is as of, top corner, it's as of the 22nd. So it's pretty recent information. It's much different information than it was last year. I wish I could compare that, but this wasn't available at that time, but it does show that there are still cases, and some of serious nature, in our hospitals. You'll also note way to the right, in the note column, you'll see that the hospital's staff are actually suffering again from various COVID infection as breakthrough cases. So staffing is an issue as well in the hospitals. Next slide.
Mr. Curry, this slide, the title is incorrect. This should be the consent numbers for the safety check testing. This is not vaccination rates.
I put some wrong information in.
Yeah, the heading should read safety check consent, not vaccination rates.
Oh, I apologize.
What is it, Bob?
The safety check
Safety check.
consent.
So this is a quick graph provided by the Superintendent Jokela and staff. It's actually the safety check testing. I think I wrote vaccination on there. I apologize.
Yeah, they're right here.
Is there anybody in the schools that are well-versed in speaking about this information? Because it's kind of Spanish to me. I'll do my best, but...
Well, the school department has started voluntary, what used to be called pool testing. Now it's called safety check testing. This is the nose swab testing that's performed in the classroom. So this year there's a different vendor performing that testing. Yesterday was actually the first day that the safety check testing was performed this school year. And after reviewing the September 15th voluntary signups, we asked staff to go to the website and consent to the testing. And 2 slides further on, you can see that the percentage of staff increased from 35% to 64, almost 65%. The percentage of students across the district increased from 20% to 30% from the 15th to the 23rd. So we're experiencing an increase in voluntary testing amongst staff and students, and for an overall population, we're getting closer to 40%, 41% of staff and students who have voluntarily signed up.
Thank you. Next slide is a quick snapshot. Very difficult to see. These are actually Department of Public Health vaccination rate statistics. The first column is as of September 16th, 2021, ages 12 to 15. You'll see that Fitchburg, about 60% Fitchburg of that age group in the city is vaccinated. The next column is age 16 to 19, and that's also as of September 16th. A little bit lower, half of the 16 to 19-year-olds in the city are vaccinated. And then a little bit better on 20 plus, about 62%. So I do know the schools have a goal of October 1st of 80%, so that they can lose their mask mandate. We still got a little work to do and not a whole lot of time to meet that mandate. But next slide is the consent numbers. If you wouldn't mind, Superintendent Jokela or staff, kind of explain what this graph is all about.
Okay, so this is this slide and the 2 slides prior are the same information except 1 week apart in terms of time. And this slide shows the consent numbers as of today for people who have signed up for the safety check, again, formerly known as pool testing. By school, all our schools are listed here, from high school to our elementary schools. So from a staff perspective, we're grateful and to see that the staff percentage has increased from 35% to 65%, and the number of families who have consented to having their students tested from 20% to 30%, and the overall numbers from 26%, which was about 1 out of 4, to now 42%, which is 4 out of 10. So we're seeing increase in the voluntary signups for the safety check testing, which is the nose swab testing. So we're thankful for that, because that allows us to identify any potential COVID cases in the district amongst staff or students.
Thank you, Superintendent.
There's a question, Bob.
Superintendent,
Yep.
may I ask a question?
Sure.
Who is doing the pool testing or the consent testing? Is it the nurses in the school?
No, it depends on the school, what staff.
Oh, okay. I was just wondering how that was going, if it was the school nurses.
No, it's not the school nurses. So in every school, we had a posting.
Yep.
Someone to handle the
Okay, great.
COVID testing. So it's different. It varies by school.
Okay, thank you.
But in terms of the actual physical doing it, it's self-administered. Kids are swabbing their own noses.
Right, but you've got to wait 15, somebody still has to coordinate it.
Right.
Yeah.
I just wasn't, I
So
want to
we have
make sure.
coordinators at every school.
Yep, great,
Yep.
excellent.
And I think the other thing to pull out about that testing is, one of the changes with this new vendor is that it's a double swab. So what was a problem last year was you would do a pool, and then if something came back positive, you had to then bring everybody back in that pool and test them. And now we don't have that problem. You have a double test. So if a positive comes in the pool, then everybody also has an individual sample, and then they test those individual samples. So I just
Thank
wanted to
you.
make sure.
Okay, before we get to the next slide, I see that there's one slide missing. I'd just like to discuss the age groups of our current active cases. At present, as of Monday, of the 236 cases we had on Monday, age 0 to 5 there were 22 cases. Ages 6 to 10, there were 28 cases. Age 11 to 15, there were 20. Age 16 to 20, there were 21. And that's out of the 236 total cases on Monday.
Steve, what was the first number?
50, 70.
What was the first number, Steve?
First number was age 0 to 5, 22. I apologize, that slide somehow was omitted in this presentation.
Every age group you said is in the 20s.
Anybody hear that question? Because I did not.
Every age, well, they answered it, but every age group you mentioned is in the 20s.
I still can't
Okay.
understand.
Every age group
You
you
either-
mentioned, Mr. Curry, is in the 20s.
Yeah, that's okay. They got it, so.
Yep.
Thank you.
I apologize.
No,
You couldn't understand it?
it's hard, Steve.
Steve, could you just tell us the numbers from 0 to 12 then? Do you have a total of active cases, 0 to 12? Those would be unvaccinated folks, in other words.
You want to know the age group of,
No, you gave us numbers 0 to 5, then 5 to something, 7 or 8, and then up to 12.
Yeah.
I'm just wondering, from 0 to 12, if we summed up the number of active cases, in other words, I think there were around 20 cases, 0 to 5.
yep,
Sorry to bother you with that.
that's okay. I would say it's somewhere between 50 and 60 cases
Of the,
from age 12 to age
from 0
20.
to 12.
0 to 12 would be about 50 cases?
50 of the
Yep.
200 or so.
Yep.
So those would be people who couldn't be vaccinated anyway, so,
Correct.
well, yeah. All right, thanks, sorry.
Sure, did that answer the question?
Yeah,
It's a bit of an estimate. I don't have the exact ages in front of me at this time, but
no problem. I just try to embarrass you, that's all, every chance I get.
I appreciate that. I do pretty well on my own. I don't need help, thanks. So the next slide, and sort of just for discussion, locked up. Oh, there we go. I provided some, if there was interest between the two committees, I did provide some sample testing mandate language. I believe this language is from another community. I did try to black out that community, but it's pretty basic language. It just discusses that employees will agree and sign an agreement that they will be tested on a routine basis, whatever these committees decide. And it also allows for exemptions, and there will be a sample exemption form at the end of this slide. The next slide is actually vaccination mandate within the public schools language. So and obviously this is just a sample, but for discussion, it would require employees to become vaccinated or provide exemption status on an exemption form. And that would be either medical or religious exemption. In that we would agree as a city, if this mandate were to take place, that we would provide vaccination clinics. The vaccination date on this form is October. That is just a sample. There have been recommendations on a date, but I will leave that open for discussion after this presentation. Any questions before I move on?
If somebody opts not to have, they get the exemption, they get a health exemption or a religious exemption, will they still need to be pool tested?
According to this language, yes. That would be the exemption would actually include language that if you can't be vaccinated, then you would agree to be tested on a regular basis, which is most likely weekly, or whatever these committees decide.
And this is boilerplate language.
Correct.
We can pass our own language.
I just want to get
Yeah, no,
a
it's
taste
helpful.
of what the language was,
Right.
because sometimes mandates are a little scary.
Right.
Yep.
No, it's helpful.
Okay. And then the next to last slide is more language. It basically discusses the exemptions, and you would have to provide proof of vaccination for new employees by way of a vaccination card. And then it discusses language about the two exemptions, which would be medical, obviously have to be signed by a physician, and then the religious exemption. And then the sample exemption form is actually on the last page. Or the second to the last page, sorry. Very hard to see.
I just have some clarification questions about process to ask. In this process tonight, I know coming out of a subcommittee of the school committee, we had several proposals that we wanted to vote on. So one was a mandate, a vaccination mandate for staff. One was a testing mandate for students. A third was, if that isn't possible, right, if that doesn't pass, a testing mandate for all students involved in sports and extracurricular, and that would include a testing mandate for advisors and coaches. Because one of the things that we heard from the athletic director was this is a very difficult thing to gauge every day, right? Like you're going into sports and kids are not wearing their masks for that. It is, some of the venues are outside, but some of them aren't. And so it would just be a helpful tool to be able to have. So in our joint meeting process, can somebody explain what the process is going to be in terms of taking votes on those proposals?
We can only vote on what's on the agenda.
Well, the agenda is very vague about mandates, right?
School
So,
testing mandate discussion and vote, school vaccination mandate discussion.
but there are different versions of the testing,
Do we
right?
have wordings of those?
So
Do we have
can I-
exact
Yeah.
wordings for those items?
One of the things, thank you, Mr. Curry, for sharing the, a sample agreement. And, one of the things that this would still require would be some bargaining with the respective units. So we have shared some information and documentation with those units last week. They were to take that back to their membership. They were aware that there was a joint meeting tonight with Board of Health and the school committee. And, as the superintendent, number one, my goal is to keep a safe and healthy school system. And the mask mandate has helped, been as one mitigation strategy against COVID-19. Having a testing mandate for staff, clearly we have, we've improved dramatically over the last week, but until we know from a staffing perspective, we can have 100% tested, because we have had staff and students have breakthrough cases. So testing just for those who are unvaccinated is not enough with this Delta variant. And I believe that the vax mandate, as mentioned or stated in this proposed agreement, along with the two, what's the correct word here, exclusions for medical and religious reasons, has been standard and used in other districts where various units and school committees and towns have agreed to. So those would be the things at this time that I would propose. I know Ms. LaBelle Pierce and Mr. Stevens have also talked about the after-school programming, the extracurricular, which is a little bit different from the standard school day. So participants, school districts are not required to provide extracurricular, so the testing requirements and vaccination requirements can be different, and especially in the cases where we hire part-time coaches who are not school staff. Or they could be after-school tutors, right, John? Correct. So having that extra level of, I'll call it COVID risk mitigation, would be helpful as we continue to go through this pandemic. So that would be my request of the Board of Health to issue some type of order to that extent. So then I can go back and, have an agreement that has dates that allow some flexibility in time for people to follow the agreement. So.
Bob, I guess my question is this not, would it not be advisable to wait on a vote until collective bargaining groups decide on whether or not this is something they'll
This is
accept?
something, this is impact, this is impact bargaining. So when we went back to to use the mask order from the Board of Health, that was something that actually we
So, excuse me. So I think if this is something that is passed by the Board of Health, I do not think it is required for us to go back and negotiate that with the union.
Can you say that again, John?
So if the Board of Health decides to pass a vaccine mandate, it is not something that needs to be negotiated
Okay.
because it's by the Board of Health.
But there's also the possibility that the school committee passes a
Correct.
vaccine mandate, should the Board of Health not.
Correct. So if the school committee or Board of Health passes a mandate, it does not have to be.
But to be...
That's a
but to
good
be-
question
but-
also. Is it a combined vote tonight?
But to be clear, the school committee is not a health body.
Correct.
Right. So are we, I guess that was my question. We're in a combined environment right here. Are we all going to vote?
I do not believe it's necessary for the school committee to vote. This is a Board of Health decision to make, if they elect to make an order, given the comments, given Mr. Curry's presentation and the comments made by Mr. Thompson, myself, or the school committee members in general. So I believe it's up to the Board of Health now to take all of that into consideration and go into deliberation. The last meeting we had, that when it was regarding the mask, was virtual. So, there was kind of some conversation back and forth, and then ultimately, if I recall correctly, Mr. Curry outlined kind of the basics of what the mask order would entail, but needed to just run it by legal to kind of dot all the i's and cross all the t's.
Correct.
So that was the process last time. So I guess it would be my assumption that it would be a similar process this go around.
Just because I'm not sure I heard every
Yeah.
word, and I apologize
That's
for that.
okay.
I think I'm getting...
Can I say something before we continue?
Sure.
Don't apologize, because we already know we have audio acoustic challenges in this room, and we're addressing them. So it's difficult. It's difficult. That sound just goes right up through the ceiling. So we're addressing that, but it's difficult to understand the masks along with the,
Yeah,
the
thanks
physical
very
makeup
much.
of the room.
And I
Yeah.
know the masks make
So
it
that's,
difficult
yeah, it's,
also.
we know, we recognize that.
But I just want to understand what we're doing. If I'm understanding that this is going to come down primarily to a decision by the Board of Health rather than the school board as to what should be mandated or at least strongly suggested for the schools. And also, if I'm understanding, I think it would be helpful to you if it were mandated that vaccinations be performed or required and that masks be performed. Tell me if I'm misinterpreted, but I think those are the things that, at least as I see it, would be helpful for you to get to the 80% so that we can get rid of these masks. And also, I think it's the right thing to do for students and staff to protect them. Did I get that right?
Well, there's the testing as well. You said masks, but there's also
And
testing.
the testing,
So,
yes.
so the masks, the mask order has not been rescinded either by the Board of Health or by the Department of Elementary and Secondary Education. So the testing would cover, again, all staff. We're at 65% now, so the remaining 35% would have to participate in the testing. And then for the vaccination mandate, a large number of our staff have been vaccinated, though not all, and this would be an incentive to get vaccinated, going forward. Again, but I think we still need to continue the masks wearing. Again, we're following clean practices in school, hand sanitizing, but also the testing. We need to have a belt, suspenders, and galoshes approach to this this ongoing, I don't know, storm or saga, whatever metaphor we want to use here. So it just helps that we have as many tools in our toolbox to address this, because at a practical level, Fitchburg, like many other school districts, does not have very many or any substitute teachers waiting in the wings. And we're we're short with paraprofessionals and other various groups of employees across the districts already. So in addition to being safe for staff and students, it also helps from a quality of education and continuity of education and operations for the school department.
So if a staff or a teacher refuses to get vaccinated, that person would not necessarily have to leave. That person could be tested every couple of weeks, and as long as that
Every
person
week,
remained
yeah,
negative,
at a minimum every
could
week,
stay.
yeah.
Right.
Yes,
Yeah.
yes, and yes.
Yes. Yep.
So at this point, are you asking us to vote on these various mandates as a Board of Health then, or?
Yeah, again, I think whether the terminology is mandate or order, however the wordsmithing happens, that's what we would be, that's what I would be requesting to, again, keep as healthy and safe school environment as possible.
Well, I would ask, and tell me to be quiet if I'm talking too much, but I would ask the other members of the Board of Health if they have any additional comments or questions, or if anyone on the school committee has any additional comments or questions.
Yeah, I would like to make some comments. So I'm a teacher, obviously not in Fitchburg, because I couldn't be on the school committee then. And I feel like it's important to say and think about what the reality of a school is, and I feel like I can give some insights into that, having done this job for over 2 decades. I think if you ask yourselves right now, how many people do you come into contact with every day? How many mitigation policies have been put in place for you to stay safe from COVID infection? I think it's probably a lot, right? I know a lot of my friends who still work from home. I see 115 kids a day. I can tell you that about 15% of them are not very good about keeping their masks on. I have no idea what their vaccination status is. I know mine is. I know I'm vaccinated and therefore hopefully protected. But I feel like whether you look across the country or you look at our own numbers, if you look at the UMass Memorial ICUs right now, every possible tool that we could use should be engaged at this point to know what we're dealing with. And I personally, I'm sorry it's falling to the Board of Health, because I would relish the chance to vote for this. And I hope maybe at some point I will be able to vote for it. But I honestly think we have been given free testing. I don't know why we wouldn't mandate testing for every student and staff. We would then have a lot of data. We would be able to protect people, and we'd be able to prevent infection perhaps from spreading in people's families, because that's where it's spreading. That's where it's spreading. And I'm hopeful that it's not going to spread in schools, right? Because we are wearing masks, and most people are vaccinated. But I have to say the Fitchburg numbers are low, like 60% or 65%. That's not high enough to meet the 80% threshold that the state wants to see. And it's time to make sure that we're going to protect families in this city. So personally, I wanted to see language about testing of students, and whether, I guess I'd like some clarification still, because I still would like to make sure that we are going to mandate testing of people in extracurricular activities, and that would be students in extracurricular activities. So I don't know if that's going to be a Board of Health decision, but that was definitely something that the Student Support Committee wanted to put a vote out for. So anyway, I really thank you for your service. I think, Steve, you've been great in giving us updates about where we're at, and I think we all were hoping this wasn't coming back, right? I think we are all tired of it. But I live it every day. I see a lot of kids. Not that Fitchburg Public Schools has fights that you have to break up, but just this week I've had to break up 2 fights. Masks are off. Kids are all around each other. You know, it's not this neat and tidy little thing where, you know, everybody stays 3 feet apart from each other. It's not really doable to stay 3 feet apart from each other in education. And it shouldn't be.
Again, if I understood, I don't think we're ever going to attain perfection. No, I mean, it's not going to be, everyone's not going to wear a mask all the time and wear it perfectly and wear the best mask available. There are going to be lots of times when we fall short. But I think every effort we make improves things. I got an email today that there's not an ICU bed available in central Massachusetts. I mean, nothing. So if you have a heart attack now, you're going to have to push a COVID patient out, or I don't know what you do, wait in a hallway or something. But we have to do something to try to control this illness. And I know these methods are somewhat primitive, some of them wearing masks and washing hands and socially distancing. But certainly the vaccines are by far the best thing that we can do. I know we can't convince everyone. I'm not sure why. And maybe we'll select out that population eventually, but unfortunately. But I think that at least I personally favor vaccines for everyone whom we can encourage to do it. We can't make everyone do it, but certainly should encourage it. The carrot would be that when you get to 80%, you can get rid of your masks and enjoy life a little bit better. But my own personal feeling is, as much as I dislike the masks and everything else, I think these are the things we have to do to protect the students and staff and population in general. That's just what we have available right now.
And can I just?
Oh, go ahead, Brian.
Yeah, can I just add that, you know, if the Board of Health, you know, does agree to, yep, so if the Board of Health decides to issue a new order and we're able to, as a school district, have record of staff who are vaccinated, that would also help us from a test and stay perspective to know, because there's different protocols for people who are vaccinated and those who aren't vaccinated in terms of, you know, if they have to quarantine or how long they have to quarantine. So it also helps potentially keep staff in the building as well. So, and students, because at older grades right now, students 12 years and older have between 50 and 60% have been vaccinated.
Could I just ask one other question, and maybe it was answered and I just didn't get it, but we have exemptions for medical reasons. You know, you have allergy or can't take it, and when we have religious exemptions for whatever reason.
Mm-hmm.
Do we have exemptions for people who say, you know, I just don't want to get it, I don't trust it? What happens to those people who
They are,
say, you know, I'm not interested, I don't want to do it?
they're being tested at a minimum once a week. Potentially, again, the Board of Health could say testing twice a week if so necessary. And this sample agreement, those who don't have documentation, they would then be responsible for their own mask. You know,
N95, correct?
yeah, the N95 mask. So again, there'd probably be some things that we'd have to bargain still, but that's kind of I think, the general language in this with what Mr. Currier shared.
So we don't really have a category for them, we just have to have them be tested, if I'm understanding,
Yeah, testing and
masking.
Those who fail to participate in the testing may be subject to progressive discipline. So we're requiring the testing as for all staff. And it's our hope that we don't have to resort to that you know, everybody agrees to be testing. And again, just from the participation increase in the last week, we've gone from 32% to 65%, or 35%, excuse me, to 65%. Staff have stepped up. It appears that, they're willing, and whether it's, 35% that remain or 30, the goal would be to get to 100% so that we can, at least from a staffing perspective, have a complete understanding of, on a weekly basis, who potentially may be positive. Because we want to limit the spread of this virus in our school and in our community.
Sandy, did you have a?
Ms. Knight?
Yeah, going back a few minutes to when you were speaking about the schools, and I'm sorry I'm not addressing you properly by your name, but I'm very much aware of what goes on in the schools. I'm a substitute nurse in another community, I won't say which one, but.
Yeah.
And my daughter's a school nurse too, so I listen to her every morning when she drives in and every afternoon when she comes home. So I know the horror that she goes through and that the teachers go through. And so, yeah, I do agree with all of this and everything that you've said, except there are those people, the staff members and the parents of some of the students that are going to stand their ground, and they're going to be very assertive, probably, and not want this for their children. How are we going to handle that? I worry about that. I worry about that.
I do too.
Again, at this point, we're just talking about the staff for the testing and vaccination. I want to be clear. This is not.
That's what I thought originally. Then
Yes.
I thought that I heard
The only area where we'd be asking any language on students is in regards to extracurricular activities.
Okay, great. That clears up a lot for me.
I mean, if I had my way, we'd be talking about students. But I guess, I will take it as we can. I mean, you're telling us there are scores of children who are testing positive right now, and they're going home to families, and potentially, it's circulating. So, but I understand, what victories we can get, where we can get them.
Okay. So with that all being said, last week President Biden gave a speech, and he mandated that all businesses with 100 or so, with more than 100 employees, would have to get vaccinated, or if they had federal grants. Doesn't that really sums it up right there for us, doesn't it? I mean.
Not necessarily.
Okay.
Massachusetts is a local control state, and while President Biden issued that order, it's up to states, as I understand it, it's up to states to oversee the implementation by OSHA. But from a municipal perspective, as we've seen over the last year and a half, the governor has issued no mandates, and in all 351 school communities, the agreements have been agreed to at a district level. There has been no statewide template or agreement or mandate for any of the negotiations in any school district.
So what would be the other side of that coin for us as the Board of Health and even as the school committee to say, we don't really care if you get vaccinated or not, just come to school. We don't care if you wear a mask or not, just come to school. We don't care if you socially distance or not, just come to school. I don't think that looks very good or sounds very good. So, I don't know, to me, it's almost a no-brainer what the right thing to do and to say is, as unpleasant as it is.
Yeah, Doctor, you're absolutely right. It is unpleasant. What's convinced me was the last meeting we had, school committee meeting we had, and conversations I'd had with the superintendent. This has become an issue of staffing more than anything. People get sick. We don't have someone we can, if we want to keep these kids coming to school, getting out of the house, which is what's important to me, then we need to institute this because we can't afford to have teachers or paras or anyone out because of COVID. So, and any illness is difficult, but again, we don't have, a bullpen of people that we can just pull and say, okay, you're taking over in that classroom today or this week or for the next 14 days, whatever it might be. I mean, it's a real hardship. So, yeah.
As you've seen in a handful of communities in the eastern part of the state, they've had to call the National Guard in to provide transportation services.
Driving buses.
Okay, so that's, whether you're a public school district or the transportation company transporting students to the public school district, or almost any employer, whether it's hospitals or manufacturers or restaurants, at this point in time, everybody is challenged to find staff and to provide the level of services that, in our case, our students and families can rely on. And as we return to full in-person learning, we want to be able to provide the best possible assurance to our staff, our students, and our families that we'll be able to provide education for the services to their children in person. As for a good portion of the last year and a half, many of our families struggled and our students and staff all struggled during this remote learning, and that is not an option on the table. So, there's, I guess, to quote or repeat a quote somebody told me, and as you brought up earlier, Dr. Bogdasarian, I guess perfection is the enemy of good, and I guess we're just looking to get better here from a COVID, health and safety risk management perspective.
I think that, we recognize that all of this is a significant imposition on people to have to get vaccinated, to have to wear masks. But I think you're bringing up a point which, to provide equal opportunity and education for all people, we have to have in-school teaching, in-person teaching. And in order to do that, we have to do the things that keep people safe. And those things, again, are to be vaccinated. And we can create a category, I suppose, for those who just, for whatever reason, refuse. But those individuals should then be tested fairly frequently to be certain that they're all right. And then again, masking, hand washing, social distancing, all those things.
Could I just add another point? And just echo, as if you feel it's unpleasant to have mandates, I mean, it was unpleasant to teach through Zoom. And kids, the amount of despair and anxiety and depression that increased among children was tangible. I mean, I could see it, and we don't want to go back to that. No. But on another note, and I think this is an interesting way to maybe explain it to people, for instance, there's a cold that's going around right now, and it's a cold. It's not COVID, but I have 4 students that would normally have to be out of school right now because they're coughing. But they've gotten tested, right? And our testing system has said, nope, it's not COVID. And they're able to be us. So this is that's personally why I think we should be testing students as well, because it will increase their ability to stay in school as well. I understand that may be an time, but it's a tool. It's a tool we have, and we should be using it. So I certainly hope the Board of Health can give the school systems any tools that will be useful.
And just to echo that, I feel like we're talking a lot about what would be convenient for people, what would make people upset, or like you said, the parents would be upset about it. I really, not talking to the Board of Health, but this is life and death that we're talking about, and I feel like this is one of those moments where, we have to decide to really be leaders and do what we need to do and do the right thing. And it's not going to what everybody wants to do, but this is one of those moments where, like, we really have to step up and do the right thing, which luckily, like you said, is a no-brainer. So to me, the only further discussion that's necessary is finding out how far our measures can go that are going to be effective and instigate every single one of them. And just to echo what they said again, a big part of this and a big part of the context around this vote tonight is the staffing, the critical staffing situation that we have, where if we have a single outbreak among the staff, it could be critical to the operation of the school district. And after the gap of education last year being remote, we just can't afford that. So with that said, I pray for your relief.
I think we have two goals. One is to keep people in school for in-person learning so that everyone can have equal opportunity at education. And the second is to keep everyone safe while we're doing that, or as safe as we can. Again, we can't be perfect, but we can do what we can to make it better. I think those are the two goals. And as I said, the other side of the coin would just say, well, we don't care, come any way you want. I don't think that looks very good these days, especially as we see younger people getting sick now and hospitals filling up. So I think it's a terrific imposition. The last 2 years have been miserable this way, but unfortunately, I think we just have to continue to do it. Vaccines are the secret. I think the more people who will do it, and I think there are outside pressures too. People who don't want to get vaccinated are going to have trouble getting on airplanes, trains, going into restaurants. There's going to be a lot of other pressures besides school that are going to make people get vaccinated, or else they're going to be sitting home a lot.
Yes.
So I think the board is ready to make a motion, if that's okay.
Well, I believe there's someone wishing to make a public comment.
Oh, okay.
Yeah, thank you.
Yes, Jacqueline Wenchie from 170 Belmont Street. I wanted to make a comment on the COVID-19 update portion of the presentation. I think some of the statistics are a little bit misleading. For instance, the case numbers went up, but that's because a lot more tests were done. You do more tests, you're going to get more cases. I looked at Maven, the MADPH website. The most recent number of tests was 4,297. That covers a 2-week period. Prior to that, it was 3,678. Before that, it was 3,482. Before that, it was 3,088. You test more people, you're going to get more positives. I'm not sure how you came up with a positivity rate of 5%. When I looked on Maven, I saw for Fitchburg it was 3.54%, the most recent interval, which I checked yesterday. Prior to that, it was 4%, which is higher. Prior to that, it was 3.93%, which is higher. So the positivity rate that I saw for Fitchburg was coming down. This is consistent with nationwide trends, except for the Pacific Northwest. Delta has peaked in the United States. We see other towns like Provincetown and Kingston, Mass., which are rolling back their mask mandates. I think we have a state mandate to cover schools, daycares, and other facilities. The local mandate's redundant, it's unnecessary, and it should be repealed. Anyone who is at serious risk of COVID has the opportunity to be vaccinated. The average age of death in Worcester County of a COVID patient is 74. I also looked at their chart of hospitalizations. It's mainly older people. You can't even see the younger kids on the graph. That's how few they are. Yeah, they have cases, but they're not being seriously impacted. And in any case, the state mandate covering schools can take care of them. I don't believe a city mandate is needed. It restricts people, it restricts adults, and we have the opportunity to make our own decisions and protect ourselves with a vaccine and not be forced to wear a mask if we want to go someplace like the library. I would also bring to your attention the case in the Miami Public Schools. This school year they had a COVID outbreak. It was serious, 13 people died. None of them were students. All of them were teachers and staff who had refused to get vaccinated. And, that's their choice, and they paid the price for it, but I don't think vaccinated people like myself should be forced to wear a mask to go into a municipal building. And I think things are getting better. We're over the Delta peak, and we need to celebrate that success and move forward with lifting restrictions.
Thank you.
Thank you.
Can I ask a question? I'm just curious as to how you are able to access Maven.
I have a link in that someone had sent me that I go into and I look it up.
You're not actually on the Maven website to access the data. You have to be trained, and the state has to appoint you. It has to go through the State Department of Public Health.
Well, I look at it and it's different tabs you can click on. It has a local tab where you can search within county by community. It has a demographics tab. You can
Yeah,
look
I
at
don't
age,
think that's
gender, race.
Maven. I don't know what you're looking at, but it's
That's
not
the
Maven.
state, that's DPH, that's not me.
Okay.
That's just DPH, city and town.
All right.
Yep,
That was a public comment. There's no debate.
right.
No.
Thank you. Thank you, ma'am. Appreciate it.
Thank you very
Yes.
much.
Can I speak to, my name's Kathy Jones, I'm one of the nurses here for the Fitchburg Public Health. I looked, the last couple days, I looked back for all the clusters. So what Dottie and I do right now, we kind of track all the clusters in the city. So it's not just, so we deal with clusters of schools, but also daycares and mostly daycares, but then there's a couple employers like Great Wolf Lodge, Cumbies, there's different ones. So I went back and looked just to see for the last 3 or 4 weeks, every school in Fitchburg has a cluster or has had a cluster in the last 3 or 4 weeks. The only school that didn't was Goodrich. That's the only one. Besides Fitchburg schools, Monty Tech had them, and St. Bernard's Elementary did. We also had other Fitchburg outbreaks were at our father's house. We had 4 daycares, home daycares, and that's exactly what you say. If our kids or the teachers are positive, then they're bringing it home to their kids, and then we have daycare clusters. Those daycare clusters, the kids can't go, and now they have to be tested, and it's just 2 more weeks of off-putting. So I think we definitely need to mandate vaccines, and we need to do as much testing as we can. Unless we do it, we're not going to know the data. We can make data say anything. We can make data say whatever we want, but I'm in the trenches. I've been in the trenches since March of 2020, so I think it would be silly.
Thank you.
Thank you so much. Thank you.
Anyone else in public comment?
I've been speaking with Fitchburg State University, in which they did have a mandate for vaccination. I think they had to be vaccinated by mid-September. And I spoke with one of the girls who's on the COVID tracking team. They contact us when they have positive cases. The cases have gone down quite a bit since the mandate took place, and she said today that they were at 90% faculty and students who are vaccinated, which is really good.
And I'll just say one other thing about the statistics that were presented. Deaths in the elderly, I think that's true, but those statistics came about at a time when kids weren't in school for a whole year. They've been home, and so they haven't been mixing. So I don't think those statistics are something that we can say will apply to when kids are all back in school and mixing. So those may not be exactly representative of what would happen when kids are back in school. So anyway, that's it for me, and Sandy wants to make a...
Next agenda is school testing. A vote by the board?
Yes, before I make a motion, I just wanted to say that I'm hoping that Pfizer approves pretty soon the vaccine for children 5 and above, 5 to 12? Because I'm really hoping and praying that that makes a difference in the schools, but that's just on the side. So I'd like to motion that we approve the school testing mandate for the staff of Fitchburg Public Schools, and that we mandate vaccination for all of the staff members in Fitchburg Public Schools. Do I need to say more?
Mr. Mayor, if I may interject,
Yes, Steve?
Pointed out before.
Wait a minute, we got Steve here.
there is a remote version. I don't know, maybe the FATV folks can answer the question, but there is a link to watch this meeting remotely. I don't know if there's anybody online that...
There is not. I'm on it right now. I don't see anyone.
Okay.
We have Craig Shalfa, who's a member of the Fitchburg Public Schools, but other than that, I do not see anyone else on.
Okay.
Excellent, thank you.
Yep.
You may
A
continue.
motion was made?
A motion was made. Do I need to add anything to that motion? Am I leaving anything out, guys?
So the motion is that we adopt the mandate for vaccination of staff.
And
We're just talking
testing
about
of
staff
staff
at this point,
on a weekly basis, if,
for staff,
yes.
with allowing exceptions for medical and religious
Religious
reasons.
exemptions.
Just for the vaccine, not
And
the testing.
should we have a category for those who just, it's neither of those reasons, they just don't want to do it? In other words, I don't think we can,
There's language in this
There is
proposed
language, yeah.
agreement that would address those hopefully very few cases.
I'm sorry, I didn't hear it, but
So they would be
Yes, there is
tested?
They would be tested, but there is language in this agreement for those who refuse to do the testing.
yeah, they would have to be tested. So can you make sense of that and restate your,
Oh, don't make me do this again. My voice is giving out. Can you, Ian, I'm calling you in here.
So I'll make a motion. I don't know if do we want to do these separately?
Yeah, we'll have
Do
to.
separate motions? So
Yeah.
I'll make a motion to approve the testing mandate for all staff as a condition of employment of Fitchburg Public Schools. I think we said weekly testing.
Yeah.
and I would be in favor, I second that.
All in favor?
We're all in
All in
favor?
favor, yeah. That passes.
Next agenda item. You're doing them
We
separately,
got to do
correct?
the staff.
And I will make a motion to approve the vaccine mandate for all Fitchburg Public School employees, unless they have a medical or religious exemption.
There you go. I second that.
And I'm in favor also, so.
All in favor?
All in favor, it's unanimous, thank you.
Do we have a date for when?
Well, I think that would be something we would have to bargain. I
Right.
just think bargain. I think,
Okay.
just, is there a third item for extracurricular?
Yep, thank
Was
you. A third item for requiring testing of any students involved in, and staff involved in extracurricular activity. So they would have to become part of the pooled testing
On the
system.
agenda, though.
It's not on the agenda.
No.
Yeah,
You
there-
can't
you
vote
don't
on it.
see-
It's not on the agenda.
Not on agenda.
Right.
Okay.
Sorry.
Mr. Mayor,
I would just like to
should
ask
we
a
discuss
question.
a deadline of when the vaccination should occur? And have a small discussion on that?
I guess, is that something for discussion, or is that something, I guess, just from a bargaining perspective, just to meet with the units? Because this proposed agreement assumed, this would have been in place before the start of school. School has already started. So I guess I would need to, have some leeway to negotiate the dates here.
And then we can just say, subject to negotiation, or the date, subject to negotiation.
Subject to negotiation, I think,
And
would
is
be enough.
this something we want to revisit at every every monthly meeting that we have, or?
Probably would be good to have an update on the statistics and the data that's coming in, yeah. Are we making, is it making a difference?
I think that's a given, I think
Yeah.
if
Yeah, I do
the data
too.
changes, then
Right, but,
Yeah,
okay.
Act
you've been very
accordingly.
good about
Right.
giving us
Yep.
all the updates,
Right.
so keep it coming.
thank you.
And I just want to emphasize that the decision just made by the Board of Health is purely to allow in-person teaching so that everyone can have equal opportunity at education, and that it's also being done in the best interest of the health of the community. This has nothing to do with politics, is purely for those two reasons. I think it's important to understand that.
Thank you.
Thank you.
Everyone had an opportunity to speak? Motion to adjourn?
No, I'm sorry, I have one final question, and just for the group that is involved in the school committee here, I would like to know when we can consider and vote on mandating students who are involved in athletics to test. I don't want to leave this meeting without an understanding of when that can happen.
We could discuss it at our next board meeting if we have it on the agenda.
And I don't mean to be obnoxious, I just feel like
No, I
I've
understand.
been
We
trying to
understand where
get,
you're coming from.
we've been trying to talk
Fair.
about this for a while, so.
We're concerned that like 100 football players, 75% are vaccinated, 25% are not. A school, vocational school on the South Shore has already lost a week and possibly more. Their season could be ending. I would hate to see 100 athletes lose out on another season because somebody is not vaccinated or wearing masks.
So are we saying that we'll bring this back up at a future meeting? Okay, that's what I wanted an
yeah,
assurance.
We are not scheduled to meet until October 14th. Is that going to be too late? You probably want it
Well, we
sooner
should
rather
maybe,
than...
if we can't do it for this fall season, we can do it for the winter season.
So I can add just, I think in conversations amongst athletic department staff for the winter season, we would need to have that in place before November 19th was the date. So if October 14th is the next board meeting, and unless there's an emergency reason to meet, we would be okay for the next season of activities.
Okay, I'd be okay with that because that season will be indoors.
Yeah, indoors, correct. Yep.
Okay,
Very good.
thank you.
Motion made to adjourn.
Second?
All in favor?
Aye.
Opposed? It is unanimous. We are adjourned.